Good afternoon, everyone. Welcome to Cancer Reach. Cancer Reach is initiated by Dr. Krishnamani to spread awareness about the cancer and help the caregivers and patients to access the right treatment on right time. We are fortunate enough to have Dr. Krishnamani, an esteemed expert in the field of oncology, joining us today to share his knowledge, experience, and insights on liver cancer. Dr. Krishnamani has more than 10 years of experience in treating different types of cancer. Dr. Krishnamani is associated with American Oncology Institute of Hyderabad. Today's session is Know About Liver Cancer, which is formidable adversary touching the lives of not only those who are diagnosed, but also their families, friends, and communities. It is a battle that demands our collective attention, empathy, and united efforts. Throughout this session, we aim to explore various facts of liver cancer, from understanding the risk factors, early detection, diagnosis into the latest breakthrough in treatment and support mechanism available in those in need. Without any further delay, let's extend a warm welcome to Dr. Krishnamani. Doctor, requesting you to give some opening insights to this session.
Hello and good afternoon to everyone. Thank you. As always, welcome to Cancer Reach, which is an initiative to spread awareness about cancer. This is a month which is the breast cancer and the liver cancer awareness month. And in our live videos in this month, we have focused on breast cancer. And by the end of the month, we intend to focus today on a bit on liver cancer too, so that we spread awareness about the same. Yeah.
Thank you, Doctor. Thanks a lot. We encourage active participation from our audience. Any questions, any queries, the chat box is available down below. So without any further ado, let's start the session on know about liver cancer, Doctor. So, Doctor, what is liver cancer?
So what we should understand is cancer which is present in the liver is very layman terms is called as liver cancer. So what we should understand is liver cancer in a very layman form is of two types. One which starts in the liver or one which spreads to the liver. The one which spreads to the liver is the most common. So you will not call it as liver cancer. That is not the right word. But cancer in the liver is most common from spread from other organs. And the most common cancers which spread to the liver are breast cancer, lung cancer, intestinal or colon cancer, etc. So if you look at the number of cases, cancer being detected in the liver is common due to spread from breast, lung, or colon cancers. That is not the topic for discussion today. Today's discussion is about primary liver cancer or liver cancer which starts in the liver and it has not spread from other organs. So the problem is in the liver and the cancer has started in the liver. This is called primary liver cancer or liver cancer, or in medical terms, hepatocellular carcinoma or HCC.
Doctor, like continuation to what we just explained, Doctor, you have explained, what are the primary and secondary liver cancer?
So primary and secondary are spread to the liver or primary cancer. Keep it very simple as what we discussed. So primary is HCC, which starts in the liver. Secondary or METs or metastasis is it starts in other organs and it goes to the liver. In the clinic, the most common patients we see are they present with cancer in the liver, but if you look, they would have a breast tumor or a lung tumor or a colon tumor. But we are talking today about a cancer which has started only in the liver or primarily in the liver. It spreads to other organs or it may not spread to other organs.
That was a really great insights, Doctor. Generally, Doctor, what causes liver cancer?
So when you talk about hepatocellular carcinoma, we should understand that hepatocellular carcinoma arises primarily on a background of liver disease, which is called cirrhosis. So cirrhosis means irreversible damage of the liver. So somebody's liver is irreversibly damaged that is a fertile ground for developing cancer, which is HCC. Now, cirrhosis can be caused due to multiple factors. Some of the common factors for cirrhosis are chronic alcohol intake, hepatitis B virus infection, hepatitis C virus infection. We see cirrhosis very commonly in a condition called non-alcoholic fatty liver disease or non-alcoholic steatohepatitis. That is non-alcoholic. The patient has no alcohol intake, but the liver is damaged, it goes into cirrhosis. So what happens is the liver, the normal liver undergoes three stages of transformation. First, there is a fatty liver. Then, if the insult is continuous, that is, alcohol intake is continuous or viral load is high and the cells are getting destroyed, it goes into the next phase called hepatitis and finally goes into cirrhosis. Cirrhosis, you cannot come back, it is irreversible. Now, not all patients with cirrhosis develop liver cancer, but liver cancer develops in few patients who have pre-existing cirrhosis. And the causes we discussed: alcohol, hepatitis B, hepatitis C, NFLD, some very rare diseases like Wilson's disease, enzyme deficiencies, etc. So it is on this background that we developed hepatocellular carcinoma.
Okay. Doctor, like considering your expertise, doctor, what are the symptoms for liver cancer?
So what we should understand is many times patients can have no symptoms. So you may have a cirrhotic patient who comes to you who has a ultrasound scan or a CT scan for some other reason, and the scan has picked up a lesion or a nodule in the liver, and then it is worked up, biopsy is done, or MRI is done, and he or she is labeled as having HCC. So this is an asymptomatic patient who is incidentally detected. Incidental means he just goes, gets his evaluation for some other reason, and the scan or test picks up a liver nodule. So this is one. Another thing is somebody who comes with symptoms. So patients can come with pain in the right side of the tummy. Patients can come with cirrhotic complaints like water in the tummy or ascites, we call it, fluid in the tummy. They can have bleeding, hematemesis, or blood in the vomitus, because of which they get evaluated. Sometimes the tumor may rupture and can cause severe pain. So these are all some of the symptoms of hepatocellular carcinoma. But most often we see patients who are picked up incidentally for some other reason, or cirrhotic patients who get themselves evaluated on a routine basis.
Okay, doctor. Doctor, there is one question from the audience. What is the most common liver cancer, which is primary or secondary?
So uh, rather than going into the primary secondary debate, spread of cancer to liver is most common. That's all. Okay. Cancer starting in the liver is not that common compared to spread, because see, breast cancer is very common, lung cancer is very common, colon cancer is so common. So obviously all the cancers you put on one side, they have high chance to spread to the liver. So that answer is more common, that spread is more common. You are talking only about liver cancer, it cannot match up to all the cancers which are on the other side. So spread of cancer to the liver is the most common cause of tumor in the liver. But we are talking today about primary liver or hepatocellular carcinoma, which starts in the liver.
Okay, thank you, doctor. Like, doctor, that was a quite detailed explanation. Going to our next question. What are the investigation done to diagnose liver cancer, doctor?
So what happens is many a times when you are evaluated, when the patient is evaluated, there is a background of cirrhosis. So most of the time it is on radiological investigations that we pick up. So the patient already has an ultrasound. The ultrasound shows cirrhotic liver. On the cirrhotic liver, we may find some suspicious nodules. Then we either do an MRI or a triphasic CT scan. So on the scan, there are certain characters to say this looks like liver cancer. Like when you see someone, you can identify from which part of the country they probably come, what, like the dress they wear or the language they speak. So same way, on imaging, on a CT or an MR, if you look at a suspicious nodule in the liver, based on certain radiological features, which the radiologist will tell you, you can more or less say this looks like liver cancer or it doesn't look like liver cancer. Then we do certain additional tests, like one blood test which is called alpha fetoprotein. If it is highly elevated, it is seen in liver cancer. So alpha fetoprotein increase is not equal to liver cancer. It can be elevated in other cancers or other non-cancerous conditions also. But we use this blood test to, what do you say, as an additional part to support our diagnosis. Many places now we are moving away from biopsy for liver cancer. Now, if you look at many guidelines or international societies where experts on liver cancer sit, they are slowly moving away from biopsy. So, in our earlier sessions on Cancer Reach, we have discussed that for cancer, you need a biopsy or a needle test and see the tumor under the microscope, tumor cells. So, tissue is the issue. But in liver cancer, if your MRI or CT is showing a classical pattern and there is raised alpha fetoprotein, then you can avoid a biopsy. But sometimes, when it is tricky, when the imaging is not very characteristic, there are certain tumors like cholangiocarcinoma, which can mimic like liver cancer and which is very common in India. Then we usually say get a biopsy done. Or in patients who are no alcohol intake, there is no viral infection, or there is no background cirrhosis, then we should start thinking, are we dealing with something else? That is where in clinical practice we may go and do a biopsy. So these are the common tests which we do to diagnose liver cancer. Also, one of the most important tests to be done is a simple blood test called liver function test, where we look at liver enzymes, bilirubin to see for jaundice, albumin to see your proteins in the body. So this will help us to say how your liver health is. So liver health is extremely important. So there are many people who have given scoring systems. Is your liver function good or okay, or very bad? So they divide it into A, B, C. For example, one staging called child puke staging. Based on very simple liver function tests and symptoms, you can say, okay, this guy's liver is good. His liver function is good. His liver will tolerate a surgery or any treatment. Or another person whose child puke C means his liver is very bad. So here we are not talking about the tumor. You are talking about the health of the liver. General health of the patient is extremely important, but you're also talking about the health of the liver, whether somebody can tolerate treatment or not.
That was informative. Doctor, there is one query or a question from the audience. You can say from Vanaja Ramashetty. Good afternoon, doctor. What are the chances of recovery in case of liver cancer in kids? What can be the line of treatment and is it curable?
So, yes, liver cancer, as the line goes, cancer is curable if detected early. So this is a tagline for all cancers. So liver cancers, there are two curative treatments. One is surgery, one is transplant, liver transplant. These are curative treatments. Curative treatments means a treatment which is done with the intention of curing the patient. So in these for these two things to be done, if you want to do surgery to a patient or you want the patient to undergo transplant, the most important thing is like any other cancer, if it has to be cured, your disease has to be caught very early. So your size of the tumor should be less than 2 3 centimeters. It should not spread anywhere. It should not go to the lymph nodes. It should not spread to adjacent veins and structures. The liver health should be very good. Your general health should be very good. You should be able to tolerate the surgery or transplant, etc., etc. So definitely, if you are going to find it out that early, you are going to opt for curative modalities like surgery or transplant.
You, doctor. Doctor, are fatty liver disease and liver cancer related from the same person? The same question.
No, so basically, it is not that they're related or not. All of us will have fatty liver. It is like graying of your hair, scalp hair. What will happen is, as I told you, fatty liver goes into the next phase called hepatitis, goes into the next phase called cirrhosis. So this phases When it goes from one to another, you need some insult. If you have a constant virus sitting and eating away your liver cells, fatty liver goes quickly into hepatitis, hepatitis quickly goes into cirrhosis. Or if you're constantly having alcohol, which is damaging the liver, creating an environment in the liver where there is no oxygen, quickly it goes into hepatitis and cirrhosis. But otherwise, most of us may live long till ages of 70, 80 and just die with fatty liver. So our liver may never even progress to that state. So what we should understand is fatty liver is not that, oh, something is going to happen tomorrow to me, I will die of liver cancer. No. But generally, in this era of sedentary life, we call something called a metabolic syndrome, where people have become obese, they're very fat on the higher side, body mass index is extremely high, very sedentary, eating junk food, diabetes, hypertension, fatty liver also you can put it in that. So all this is due to a number of factors like high fat intake or high intake without any activity, or low sedentary or sedentary activity, junk food, etc. So that is where you get a lot of fat accumulation. So that part has to be avoided by us. But otherwise, fatty liver can be seen in thin individuals, in normal individuals also as a routine, and it is not a major cause of concern unless you have a triggering factor.
Sir, there is a question from Maheshwari saying, how many stages are there in liver cancer?
We talk about stage 1, 2, 3, 4 in all cancers. 4 is advanced and all that. But liver cancer, it is not that simple. So what we should understand is, are you uh, is my disease an early stage, okay, or an intermediate stage, or an advanced stage? Early stage means it is in the liver, it's a small lesion, 1 or 2 lesions, or maybe 3 to 5 lesions. They can be removed. The liver health is good. It has not gone into the portal vein and other hepatic veins. It has not spread outside the liver. So it should be within the liver, not go anywhere else. It should be small. Liver health should be good, so that even if you remove this part of the liver, the other part of the liver or your body should be able to cope up. That is early stage. Intermediate stages, you have multiple lesions, portal vein is blocked, or you have some background cirrhosis. You cannot do transplant, you cannot do surgery, but it has not spread anywhere also, that you are advanced. So you're somewhere in between. So for those patients, you call them intermediate stage, where you will treat with other local methods, which is called a TACE, TARE, etc. Advanced liver diseases, it has spread beyond the liver, or you have multiple lesions on both the sides. It is not treatable with surgery or transplant or radiological methods. So where you have to go for treatment via the blood, which is called systemic therapy, where we use immunotherapy and other kinds of medication. So early, intermediate, and advanced stage with different treatments, and all this depends upon your fitness, liver's health, number of lesions, size of the lesions, involvement of the veins in the liver, which is a portal hepatic vein, spread to the lymph node, and spread outside the liver. So these are all the factors which determine what stage you are in and what treatment you will receive.
Thank you, doctor. Doctor, there is one question from Naveen Chari. Hello, doctor. Is liver cancer preventable?
Obviously. So, what are the causes for liver cancer? The common causes: alcohol, hepatitis B, and C. So, stop drinking, vaccinate yourself against hepatitis B, follow safe precautions, like not share needles, do not share shaving kits from others. Okay. And obviously, during blood transfusion, all hospitals have mandatory checks for hepatitis B and hepatitis C. Okay. Safe sexual practices. So, these are all extremely important. So if you're going to prevent hepatitis B, C, have a very healthy lifestyle, avoiding obesity and all that, and zero alcohol intake, then at least a few factors which are very, very common for liver cancer are avoided. And definitely it is preventable.
Thank you, doctor. So moving to our next question, doctor, can you elaborate how to access liver function?
So it's a small blood test. You draw the sample. We commonly do LFT. All of you would have done liver function test. So in liver function test, we look at few things. What do we look at? We look at enzymes. Liver enzymes. They are called. They are called SGOT, SGPT. That is, how are the enzymes? The normal value is less than 37, less than 40 in different labs. So if your liver enzymes are in thousands or in hundreds, that means there is some problem in your liver. So all our liver enzymes will be okay. So you're going to look at SGOT, SGPT. You will look at something called bilirubin, which should be below 1, 1.1. If it is high, 5, 8, 10, 15, that means you have jaundice. That means there is some problem either in the liver or in the ducts in the liver, which are called bile ducts. There could be stone, there could be tumor, it could be anything. Okay, two. Three, you're going to look at an important protein called albumin. Liver is necessary for synthesis of function of protein, synthesis of protein, a protein which is called albumin. And albumin is something which binds everything that comes in the body. And so albumin, if you have a good amount of albumin, which is between 3.5 to 5.5, so somebody whose albumin is normal means their overall health is good. And somebody whose albumin is very low means your health is bad, and your health has been bad not for 1 day or 2 days, for a reasonably long period of time. So somebody whose albumin is extremely low means their health is not good, and health has not been good for a long period of time. So chronic problem, some chronic problem. And when you have low albumin, you start developing swelling around the ankles, around the feet, okay, around the shin, your face. You can have some swelling around the eyelids. You can have fluid in the tummy, all these things. So in liver function, we are going to look at jaundice with bilirubin, enzyme function with SGOT-PT, and bilirubin and albumin, sorry, which is a necessary protein, which is essential for our immunity and other functions.
Thank you, doctor. Doctor, like considering your expertise, what is the role of surgery and transplant in liver cancer?
So surgery and transplant, as we discussed, are one of the curative methods in liver cancer. So somebody whose disease is detected early, who doesn't have background cirrhosis, or who doesn't have portal hypertension, or that is the pressure in the portal vein is low, or it is not blocked. So they are all candidates for either surgery or transplant. So experts usually decide. It's a collective decision where the surgical oncologist, the transplant surgeon, or the transplant surgeon, the medical oncologist, everybody sits and decides whether somebody is fit for a surgery, somebody is fit for a transplant. But broadly, as we discussed, you should have less number of lesions, preferably one or two, size less than 3 centimeters, preferably. So there are multiple criteria. For transplant, we call it the Milan criteria, for example. So lesser number of lesions, lesser size, no portal vein involvement, no spread outside the liver, no distant spread, etc. Then uh, surgery or transplant. With surgery, the problem is if your background liver is bad or cirrhotic, then that liver cannot cope up post surgery. So they check the liver health prior to surgery. You cut one portion of the liver and the rest cannot cope up post surgery, then we are in problem. For transplant, again, it's a big thing. There's a waiting period. There should be somebody to give you a liver, and in that intervening period, the disease may progress. So that is why sometimes when somebody is put on a waiting list for transplant, they're doing a bridge therapy like a TACE or a TARE, where they do some other kind of treatment, where through the artery they give medicines which can shrink the tumor, which gives them time to go for transplant. Okay, so these are the things when we talk about surgery or a transplant. It is not as simple as I have told you. It's an extremely complex thing, and each patient is different because one, they are complex procedures. Two, post surgery, post transplant, there are a lot of precautions we have to take. So it depends on the fitness of the individual also.
Thank you, doctor. Doctor, there is a query from the audience. Any food suggestion revive damaged liver?
Any foods which can damage the liver.
Suggestions which revive damaged liver.
So basically, see, as we always suggest, for when you talk about the liver, you're talking about good protein food, dal, egg, those kind of things, soya, and all those kind of things. Okay, if your liver is perfectly fine, or like any normal individual, you're going to take normal cooked food and with good amount of protein and a balanced diet. But in those patients who have severe liver injury, they are given a salt restricted diet, fluid restriction, maybe to 1.5 liters a day, and a high protein diet. A high protein diet helps them to, if not regain the liver function, at least to stabilize the liver function.
Doctor, doctor, there is one more query from Ranjit. Can a liver transplant cure liver cancer?
Yes, technically that's the reason we do a transplant. So the patient should be very carefully selected and taken up for a liver transplant. And post-transplant, you'll be on a lot of immunosuppressive medication. If you're a hepatitis patient, you'll be on antiviral treatment. And all this is the aim of curing a patient. Okay, it is not a palliative procedure. Palliative procedures are those procedures which are given to prolong your life, but they cannot cure. But these are potentially curative procedures. But yes, there is a chance of uh, uh, morbidity or mortality or problems during transplant, post transplant infections, etc., and post transplant recurrence also. So just because transplant is done, it doesn't mean that you're going to be safe and everything is going to be hunky dory. There is always a risk that the disease may come back. That's why you have to select your patients extremely carefully. That's what transplant physicians do, and they keep their patients under very close follow up to see that they catch them early if they have a recurrence.
Sir, there is one more query from MD Samir. What is the main cause of liver cancer and what lifestyle should I make a liver cancer diagnosis?
So I think we discussed that. Main causes we have discussed: hepatitis, alcohol, NASH, NFALD, etc. And lifestyle is have a healthy lifestyle. Don't smoke, don't drink, be vaccinated against hepatitis B, uh, have an ideal body weight, do your regular exercise, eat balanced diet, home food as much as possible, and leave the rest to God.
Very true, doctor. Dr. Vanita has a query that any relationship between blood vomiting and liver cancer symptoms.
Yes. So not liver cancer symptom per se, but cirrhosis itself. So when somebody has cirrhosis, they have a high risk of blood vomiting. We call it hematemesis. There is a high risk. There's a chance that they get fluid in the tummy, which is called ascites. Jaundice can increase, and then the brain becomes numb, or they go into coma or sleep, which is called hepatic encephalopathy. So this problem is not in the brain. The problem is in the liver, because the liver is not removing all the waste. Everything gets accumulated and you become drowsy or sleepy, which is called hepatic coma or hepatic encephalopathy. And you develop swelling in your whole body, which is called anasarca, or swelling in your limbs because of low albumin. So all these are the problems because of cirrhosis, and a liver tumor may increase it. But per se, it is not because of a liver tumor, but because it is arising in the background of cirrhosis, you see it in liver tumors also.
Thank you, doctor. Generally, doctor, they have a query. If any blood vomiting, na, they should not consider it as a liver cancer.
Correct, correct. You should not consider. You can just probably spit out some blood. So the common thing is blood vomiting and blood in the sputum is very commonly misunderstood by people. So many times they say we vomited blood, but if you actually ask them, they have just coughed out blood. So coughing out blood is a lung problem or a respiratory problem. Blood vomiting is a gastrointestinal problem. So these are two completely different things. So our history is extremely important. Did you vomit out? Did you purge? Were there food particles in it? What was the amount? Was it a minimal vomiting or was it a large amount of blood? Or when you are puking or when you are coughing out, did it come with sputum, any phlegm, any greenish color, yellowish color, again streaky sputum or a lot of sputum? Have you been having cough for a very long period of time? So that helps us. Or you have had fever, so that goes in favor of a pneumonia where you're coughing out blood. So coughing out blood and vomiting out blood are two completely different things, but commonly misunderstood things amongst doctors and even lay public.
That's true, doctor. So, doctor, moving on to the next question. What is TACE and TARE in liver cancer, doctor?
So TACE is trans-arterial chemoembolization. TARE is trans-arterial radioembolization. So it is very simple. Trans-arterial means through the artery. You give either chemotherapy or some different radio particle. Keep it very simple. That goes, hits the tumor, tries to reduce the tumor or shrink the tumor. Where do you use it? As a bridge to transplant, or in somebody who is symptomatic, or in intermediate disease where you cannot do surgery or transplant, or he's not so sick or advanced disease where you need to give systemic therapy or immunotherapy. So that is what is TACE or TARE. It's a procedure. That's all.
Was quite detailed, doctor. Doctor, what are the systemic treatment for liver cancer?
So systemic treatment is used in advanced liver cancer, number one. And today, we have moved on in the last 10-20 years from chemotherapy to tablets which are called tyrosine kinase inhibitors. We have discussed it in our earlier sessions also. And today, the standard of care is immunotherapy plus targeted therapy. So these medicines, they boost your immunity. At the same time, they block the blood vessel to the tumor, which gives you a better response. So in systemic therapy, we give immunotherapy plus targeted therapy. Immunotherapy boosts your immune system. Targeted therapy blocks the blood vessels, preventing new blood vessel formation in the tumor, which helps to shrink the tumor. The other options are tablets in the form of TKIs, we say. They reduce the size of the tumor. The names of the medicines are sorafenib, lenvatinib, etc. And chemotherapy is not used in liver cancer. So one of those diseases that we do not use chemotherapy, rather we use these two different medications.
Doctor, thank you very much. Doctor, there is one query from Dr. Pradeep. Hepatitis B can result hepatocellular carcinoma, and after how many years patient develop and mode of treatment? Three
So
questions at a time.
for any viral disease, as I told you, your virus has to first, you get the virus, it has to multiply, it has to grow so big that the viral load is high, then it should start eating your liver, progress from fatty to hepatitis, fatty liver to hepatitis to cirrhosis, and then become a tumor. So this is going to take time. So it usually takes somewhere close to 15 to 25 years, an approximate figure. So now suppose I have got hepatitis C when I was born. So I'm already carrying it. So by the age of 25 or 30 or 35, I can develop HCC because you have 30, 35 years. Imagine I get hepatitis at 50 years or 55 years for some other reason. I may outlive the disease. By the time another 30 years, I may not live at all. So approximately 15, 20 years. Okay. And it depends on a number of factors. And if you damage your liver with other reasons like alcohol, etc., your chances of liver injury or getting liver cancer are much faster.
That is actually many of the psychological thinking for that also, doctor. Doctor, there is one more query from Shweta Panni. Is liver cancer genetically inherited?
No, it is not.
There is one more query from Raghava. Any chance of liver cancer in hepatitis recovered patient?
Uh, you will not expect because that is the reason your hepatitis recovered, right? So when you talk about hepatitis recovered, I mean, assume we talk about hepatitis B, for example. These patients are commonly followed, whether they are active infection or inactive infection. They have good amount of antibodies, etc. So when that is there, when they have very good antibodies, when the viral load is very low, when the virus is suppressed, the chances of liver cancer are literally very, very low. So we are not going to be worried about it.
That will be quite helpful for her. Doctor, there is one more query from Sumashri 1997. Can liver cancer be cured at last stage with Ayurvedic treatment?
So when you talk about advanced stages, generally most cancers are not curable and definitely not liver cancer. Now you're talking about Ayurveda. Unfortunately, I am not in. I've not practiced that. Neither do I have any knowledge about it. So I cannot comment about that science. But from an allopathic standpoint of view, whatever we have spoken about systemic therapy, immunotherapy, targeted therapy, they are not to cure your liver cancer in an advanced stage. They are to palliate, to reduce your symptoms, and to extend your life and give good quality of life. Ayurveda, homeopathy, we are not experts, so I cannot comment on that. But generally, as a dictum, in advanced stages, most cancers are not curable.
Thank you, doctor. That was quite informative. Generally, many of the patients, they get confused where to go, when to go, to which doctor to refer. Homeopathy, allopathy, Ayurvedic, there is a much confusion in the market. We have experienced, doctor, in fact, I should say. Doctor, there is one more query from Pradeep Kondapur. Mode of treatment of patients with liver failure is associated with renal failure.
No, so that is something which is completely different. It is called hepatorenal syndrome. That is because of your liver failure, there is a kidney damage also. Per se, the kidney is fine, but kidney is not functioning because your liver is not fine. So you treat your liver well, your kidney will get okay. So whatever cause your liver is not well, treat that hepatitis or whatever, or because of sepsis or infection, if your liver is damaged, you treat the sepsis. If the infection is controlled, if the liver gets better, the kidney will get better. It is called hepatorenal syndrome. It's not linked to the topic today like hepatocellular carcinoma. But as we said, liver is extremely important to maintain function in the body. So if your liver is damaged, if the jaundice increases, you go into coma. As I said, the brain is fine here, but it is called hepatic coma. The brain is not working because of the liver problem. Same way, the kidney is not working because of the liver problem. Solve the liver, the kidney gets better.
Okay, doctor. There is one more query. How long do you have to live with liver cancer?
As long as the cancer allows you to live with. So that's the answer. So if we are lucky enough and we are doing well and our disease is under control and we have an excellent quality of life and we are not confined to the bed, then I don't think we should complain, even if we have cancer, whichever cancer.
So this is the simplest answer, but very difficult task to be followed.
I agree.
So, doctor, what is the prognosis of liver cancer?
So prognosis varies. It depends on at what stage you pick up. If you're an incidentally picked up liver cancer in a very healthy liver, your prognosis is excellent. But by and large, the prognosis of advanced liver cancers is extremely poor. We talk about survivals ranging between 12 months to 18 months, etc. But the aim should be to prevent liver cancer, to avoid alcohol, to be screened for hepatitis B, C, prevent those infections, and maintain balanced diet and a good metabolic profile, as we say.
Doctor, there is one more query. Can liver cancer patient drink milk?
Yes, at Cancer Reach, we always tell people not to avoid any food substance. So there is no major contraindication. So definitely take milk. Nothing wrong. Somebody likes milk, please take.
So, doctor, these were some of the very interactive and informative questions which came from the field as well as this query. So, this was something on the liver cancer awareness, doctor. So, we come to the end of the session, doctor. So, as we draw this live session to a close, I want to express my heartfelt gratitude to each and every one of you. Apart from this, obviously, doctor, thank you very much for such an invaluable and expertise around this liver cancer. In fact, many of my questions and my queries are also been asked and it has been solved over here, doctor, because even I had a myth in my mind that, okay, liver cancer, they cannot drink milk. Actually, in fact, that question was mine only because one of my relatives are suffering from liver cancer and they are not taking any milk dietary, like not curd, paneer, everything they have stopped. They went into the vegan diet something. So that was something which I wanted to ask. Apart from that, yes, doctor, thank you once again for your dedication, such a beautiful knowledge sharing and your expertise sharing along with our patients. So we thank you once again, everybody who has attended and joined our live session. So wishing you all good health and strength on this journey, doctor. Thank you very much. Thanks a
Thank you
lot
so
to
much. The
everybody.
pleasure is purely mine. Thank you. Thank you.
Thank you, doctor. In fact, this is an outstanding opportunity for me to just interact with you, doctor, and also to learn a lot many knowledge about the different types of cancer in this Cancer Reach sessions, doctor. Thank you very much.
Thank you so much. Thank you.